Okay, so let me share the presentation. So this is what we covered in Learning Outcome 1. So one of the main things that we have to look at in today's session, just a quick recap, a 5-minute quick recap for everyone who wasn't present and couldn't attend on Friday. Now, the main importance of studying this particular unit is to understand what is social and community welfare. And when we say provision is the council, the local authorities, the government making provision. That means accepting the responsibility that they need to be able to provide these resources, tools, training and staff to be able to deliver care to the members of public. Now, here is where we look at understanding, say, for example, the importance of what we say is social and community welfare. Now, what do we mean by that? Social and community welfare, we mean is that basically the state is going to offer assistance to us as individuals, families, and people in need or members of public. And this assistance is going to cover the broad spectrum of health and social care. So when we look at health and social care, what we mean by that is all facilities related to medication, treatment, illnesses, and messaging, which is required to keep members of public safe from any sort of pandemic or endemic or any sort of illness, would be done by the state. And here, whether it requires giving out cash incentives, whether it requires ensuring public awareness is to be raised, whether it requires providing treatment, a vaccination, all that part of it is going to be covered under what is called the social and community welfare provision. Now, why is UK a welfare state? This is something that we need to understand very clearly when we talk about why is UK a welfare state, because when we look at after World War II, there were two main parts of reports that we need to be aware of, which were introduced. And one was the Beveridge report, which basically focused on the fact that saw basically the beginnings of the National Health Service. So in 1944, he basically published a report on the request of the government after carrying out let's say research, and that report basically sees us becoming a welfare state. That means a state in which the government provides pretty much all the basic necessities for the members of public. Now, when he published that particular report way back in the 1940s, and that led to the creation of National Health Service, or the NHS, in 1951. We need to understand what is welfare and why do we say Britain is a welfare state. So there are 5 aspects that you need to understand in Learning Outcome 1. One is that we have what is called universal credit. At that point in time, it was called cash benefits. So the government was giving out cash benefits to people to be able to, survive, carry out basic functions, and rebuild Britain, or looking at essentially dealing with diseases and illnesses and things like that. The second thing is that in the UK, so this cash benefit is now called the universal credit system if you look at current times. Now, the other is that everybody in the UK who's a citizen based here, is a member of the public, is a citizen of the country, whether it's England, Wales, Northern Ireland, or Scotland, they get free access to healthcare. Now, free access to healthcare is basically covered by the taxpayer, the government pays for it, and this includes everything from medication to vaccination to clinical treatments, and that is the second part that we need to understand. The third is, when we say social welfare, that means education is also free, is covered by the state. So primary, secondary schooling, even up to university education, we see that the government covers education and funds it through the taxation. And here, this is the third important benefit which we as members of public get when you are a citizen of Great Britain. The fourth part is public housing. If you do not have housing, or you do not have a roof over your head, then the council, the local governments, and obviously the government at the center in this case, we have devolved parliaments in 4 countries. So obviously the heads of the state, or, the first ministers, are responsible for ensuring that every member of public has a roof over their head. So that is basically constituted in what is called public housing. So when we look at public housing, people, if they don't have a place to live, they can apply to the council, and the council will then provide them housing. And this is the fourth benefit that we see, which is there when we say we are a welfare estate. Then, last but not the least, we look at social policies. Now, one of the examples that I gave essentially was that during COVID, if you see the furlough scheme, the Eat Out to Help Out schemes, or bounce back loans which are given to businesses, they were a part and parcel of social policy which the government introduces in order to drive the economy forward. Now, because this was a pandemic and it did not affect one region, but it affected the whole country. So sometimes government looks at bringing out policies which are going to be, helping us tide over those particular situations. So in this case, when we look at this particular aspect of social welfare, the government will bring out policies which are going to either curb the inflation, bring the cost of living crisis down. Like you look at another example of subsidy on the gas and electric bills, essentially gas bills, which has been given by the government. It has been extended, I think, till towards the end of April. And that is a social policy which the government has introduced, irrespective of the fact whether you're rich, poor, middle income, high income, whatever it is applicable to all, members, or all members of the public in the UK. Now, this is why we call that we are a social and welfare. We are a social estate. That means these are basic amenities, facilities provided for by the government to every citizen of Great Britain. And when we look at extending this particular aspect of it into health and social care, is what we basically mean by the term social and community welfare provision. And that is what is the main aim of understanding and reading this particular unit. So after you understand what are the welfare benefits which the state provides, we need to be able to extend those benefits and understand it from a point of view of health and social care sector. And that's the core essence of actually studying this particular unit, which is social and community welfare provision. Is that understood? Is that okay?
Yes.
Okay. Now, let's look at going forward. When we discussed Learning Outcome 1, we discussed some of the key milestones which have been introduced and how this provision of social and welfare, community has been brought in to our, healthcare system. So we look at a timeline which started in 1948, but basically that timeline goes up to 2010 with the formation of the NHS Constitution. And then obviously in terms of for going further beyond that was the introduction of the Health and Social Care Act, and then the NHS 5-year planning, which is done by the senior management and the NHS Constitution and the trust to be able to provide these services going forward, which dictate what kind of funding the government provides to the NHS. And within the NHS now, the funding is divided into national, basically healthcare services, mental health care services, and also care services. So this timeline is something that we need to be aware of, that when we talk about social and welfare, community welfare, the foundations of this was actually kept, or the foundations for this particular approach was laid out in Dr. Beveridge's report of 1944, which led to the creation of the community-based services in the UK. And that we saw going forward into the creation of National Health Service in 51. And then today we also have a national, you have an NHS Act of 2010, which is an act passed in the Parliament. NHS National Health Service has its own constitution and it governs itself. And obviously we do see devolution of power, across 4 different countries in terms of how, this is done. Now, there was a further reflection and investigation done by the government. And there was another report which was published in 1986. And this is an update to the Dr. Beveridge's report of 1944-48. And in this, obviously, Sir Roy Griffith basically looked at further defining the changes, in the social and community welfare provision within the UK. So changes which were brought across after this report instituted things like the person-centered approach, the integrated care approach plan, which the NHS follows. And obviously this also led to the creation of, further changes which were done in the National Health Service. One of the other reports, which is important, so there are 3 reports or 4 reports essentially that all of you should be reading, as far as this course is concerned. So one of them is Beverages report. So BEVERIDGE report. This is 1948. Then the second report is Griffiths report of 1986. Then we have Marmot review of 2010. And last but not the least, before the Marmot's review, we also have what is called the Lord Darzai review of 2007, 2008, I think. So these 4 reports is what I would suggest that everyone should be aware of and should have read in this course. These are 4 reports which are very important. And I would suggest that, you should be aware of these reports. And the summary of 3 of these are covered in this particular unit. So I've not covered Lord Darjai's report, but 3 of these reports and summaries of these are actually covered in this particular unit. And this is a slide which basically talks about what was Marmot's review. Now, his review was looking into what is called the health inequalities, social determinants of health and the health inequalities. Now, what does that mean? In short, if I come from a rich background, if I have access to money, if I have access to resources, my health in general is going to be better off than people who do not have access to good housing, good education, more wealth, or better medical facilities. So this review essentially was instrumental in highlighting health inequalities in England, and this report was published in 2010. Now, this report also endorses that and further emphasizes what is called the social determinants of health. So when we talk about the 5 basic benefits which the welfare state provides, education, we talk about public housing, we talk about universal tax credit system, we talk about healthcare benefits. When we talk about these influence what are called social determinants of health, which is basically non-medical factors that influence health outcomes. So this is because if you're born and you grow and you work and you live in a place wherein you don't have access to education, healthcare, housing, and say, for example, economic status in terms of money, then they are considered as what are called non-medical factors, which can influence what kind of lifespan you'll have, or what kind of diseases you might have, or what kind of illnesses you might fall into. And these are what are called social determinants of health. In short, they are called SDH. So if you come across this term SDH, you should be very clear that we are talking about social determinants of health. And this report looked into income and social protection. This looked at education. This looked at unemployment and job security. It looked at working life conditions. It looked at food. Sometimes we get to hear it in the news that I'm worried about now with the prices going up. How do I bring food to the table? I'm a single mom or I'm a single parent. So when we talk about food insecurity, a lot of people are now taking more, help from food banks, things like that. Housing and basic amenities, your early childhood, social inclusion, non-discrimination, and also looking at access to affordable healthcare services is what this report actually considered. And what it came out was that it recommended more changes to be done to ensure that these inequalities, which are basically, because of inequalities because of education, food, housing, access to healthcare, employment, and let's say income distribution, should be considered by the government to help mitigate these non-medical factors, social determinants of health, and they should not be influencing the health outcome of an individual. Now, example, people, if they have had, say, for example, and I shared this with, that during COVID, a lot of, people are on the waiting list for, say, for example, hip replacement, knee replacement, things like that. But people who have access to wealth and have access to private healthcare, they are not on that waiting list. What they've done is they've chosen to go elsewhere and get that replacement done. So this means that if you have access to wealth, or if you have access to private healthcare, then this influences the outcome of how you are actually dealing with that illness. So this is what the Marmot review actually suggested to the government, that the government should look at addressing these healthcare inequalities. Now, there are some slides which I put in for the National Health Service. I've left some of the hyperlinks on because they will take you to relevant sections of the National Health Service or the NHS website, and you would be able to read about the community health services, which we are going to be focusing on this particular unit. This particular unit focuses on three aspects of community health services. One, it helps in the prevention of providing services for better health. So it helps in the prevention of spread of diseases or illness. Second, it looks at working with the government at the local level to implement policy changes. And the third is it looks at cooperating with local authorities, which is councils, etc., and how they would then provide, services to the members of public. Here is where I gave an example. And what I would suggest is most of you should actually watch this video, which is primarily a 3 or 4 minute video, which explains the aspect of community-centered approaches, which NHS is trying to now follow. And I've given a simple example of this in the first part, is to say that assuming you've had an accident, and I gave an example that, somebody had an accident, slipped, had a swollen knee, and then obviously required lots of treatments for a couple of weeks and months before he could actually get back to normal operations. So when you look at getting that treatment, maybe you have a fall and you badly bruise your knee. You then call the A&E, ambulance and emergency services. They come in, they take you to the hospital. You get treated. You remain in the hospital for a couple of days. Once you have, been discharged, and then you come back home, that is where the provision of social and community welfare services actually starts. Now, NHS is still involved. The National Health Service or the Department of Health is still working to ensure that you are getting all the relevant material and things to be able to get back to your feet. Things like medication, prescriptions, looking at people coming to visit you at the house to find out whether you are making good recovery or not. But in addition to this, what the community welfare provision tries to do is makes available resources which are required for you to be able to work and integrate and come back to your normal life. Now, once the person comes back home, if you are in a house wherein there is no access to building, or in some places wherein you have to get access to chairs or stairs, essentially, then the local authority will provide you crutches, a wheelchair access, things like that, which will allow you to function on a day-to-day basis. Now, in this particular example that I had given, the council also made available a sofa or a comfortable seat, so that because you're recovering from your swollen knee, which was badly bruised, you cannot bend or stand too much. So they made sure that all the available articles that are required for you to function, like a stool, a sofa, crutches to walk, and a wheelchair, to basically go to places, were all provided by the council. Now, they are delivered to the person's house, and by the time you're using it, it's council's property. Once you are able to then go back to your feet and you start going back to normal operations, then in those cases, these things can be returned back to the council. And this is where resources comes in. This is where the community provision comes in, wherein you'll have a nurse coming in or a healthcare worker coming in, maybe a physiotherapist being also deputized to come in and help you with your sessions, to be able to make regular movements, to help you walk again. And those are the bits that you generally get to see, which are a part and parcel of the social and welfare community provision as a setup that we see, from a point of view of this particular unit in Learning Outcome 1. Now, the presentation covers this in a great amount of detail. My suggestion would be to go through this, and then that would help essentially cover and do a quick recap of, I would say, learning outcome 1. Now, let's look at moving on to learning outcome 2, which is where we need to understand the development of how social and community welfare provision has happened within our society, especially when we talk about Britain. So we are going to be looking at learning outcome 2 here, and that is in the unit which basically focuses on understanding the timeline of how this particular concept of welfare, which is to be driven through community provision, essentially came into the UK. Now, when we talk about again, going back to one of the reflections which I would ask you to bring is, in the first learning outcome, we talked about why is Britain a social or a welfare state. Now, I want to understand this aspect of welfare provision for community care and health and social work, we need to be able to understand that, yes, Britain is a welfare state, and when did Britain become a welfare state? So there is some history to it. Now, if we look at a bit of a timeline, this timeline generally tends to fall back on, Elizabethan poor law or era, which is from 1600s up until the 1833. After the Industrial Revolution, that makes the second phase. And I think I have it somewhere here, which I want to bring out. So this particular slide that you see talks about the foundations in terms of where and how the social and community welfare provision actually started in the UK. So anything upwards before, the 20th century, or I would say up until the World War II, is a timeline which falls into what is called the Elizabethan poor law. That means here the system of, health and social care was very weak. It was predominantly driven individually, and it was a paid system, it was a private system, and there was nothing, which basically said that, health and social care provision was provided, by the king or, at that point in time, the queen or the head of the state, nothing like that. So we put this into one category, which is from up before the 20th century. Now, after the World War II, from 1946 onwards, we see the National Health Service, we see the Beveridge Report, which I mentioned, and then some of the key acts and legislations which have been introduced over a point in time, which have steadily laid down the foundation of how community provision or community welfare has actually come into the society. So we talk about Disability Discrimination Act, Human Rights Act, and the CARE Act of 2014. Now, in order to discuss this particular learning outcome is purely theoretical. You have to understand the timelines, which are these 5 timelines, and then go about reading into what has happened during this era or what has happened during that time frame. Now, one of the main things that we look at that we are to discuss today is basically the Beveridge Report. So if we need to understand what is the history of welfare and community provision, we need to understand what is the Beveridge Report. Now, this report was the report which was launched to introduce benefits which are going to be welfare benefits for every member of the public in the UK. And this report looked into, when it was obviously compiled, it looked into the Education Act of 1944, the Family Allowances Act, the National Health Service Act, the National Insurance Act, and the Children's Act. And this report then introduced a basic bit of, let's say a structure. And this was accepted widely by the coalition government in that time after World War II. And the report then basically detailed out proposals for a comprehensive social insurance system, which would look into the needs of anything which is related to health and social care. And Beveridge's report is described as the road to social reconstruction after the World War II, when Britain was essentially looking at rebuilding its economy and rebuilding the country. So the idea there, when this report was introduced after the war, there was a famine, there was disease, and obviously there was, scarcity and shortage of all types of resources, food, construction, obviously looking at housing, education, everything was destroyed. So This particular report looked at basically, let's say, when I say slaying the 5 main problems which Britain had after World War II ended, and Britain started to reconstruct its economy in the country. And they were things like want, diseases, education. There was no work, and obviously looking at, provisions for children, and obviously health and social care. And that is where this report becomes important, because this report set the foundation for setting up what is called the Comprehensive Health and Rehabilitation Service. At that point in time, it was called that. And later on, the National Health Service, which basically allows us to receive all sorts of treatment, medication, vaccination, clinical treatments as members of public, or, as citizens of UK, as far as this is concerned. So this is the most important bit that we need to understand in Learning Outcome 2, which essentially focuses on understanding the timeline in terms of how, let's say, social and community welfare provision came into UK. Any questions on this so far?
No.
All right.
Thank you.
So what I've done in this presentation is essentially given you insight into out of the 5 benefits as a social estate that we have when we say welfare estate, is the health benefit that we need to understand, and the beginnings of how this came across into our country is what we need to read. Now, there is an handout which I have circulated in class, which I will also show you on Moodle. That's a Word handout. And that Word handout is what I would suggest that you need to read in order for you to understand the health, as one of the benefits in the social, welfare provisioning. And that handout is the handout given here. Let me just quickly show you, for those of you who are on the session today. So this particular Word handout, as you see here, which is labeled as welfare provision of community care and health and social care work. This particular handout is what you need to download and go through, and part of this handout is actually replicated on the presentation, because it explains and covers the health part of it in greater detail, and refers to the welfare provision that we talk about in terms of Learning Outcome 2. So let me just show you that handout now. There we go. This is what you will actually download, from Moodle for you to be able to look at. And this particular handout talks about how, the 5 timelines that we see on the presentation, from the Elizabethan Poor Law to the Griffiths Report, to the Discrimination and Disability Act, to the Health and Social Care Act, and then in general talking and relating to the provision being introduced, by the National Health Service in 2010. And that is what will be covered in this particular, handout when you read this through. So it talks about, various aspects of what is the right-wing approach, what is the Marxist approach, what is the conservative approach, and what is liberal approach in terms of dealing and ensuring that health and social care services are provided by the welfare, are provided to the members of public for the welfare of these citizens. And this particular report gives you the history of how the timeline came about when we talk about the provision being started by the government. And some part of it is what I have included in the presentation that you are going to see, which covers both health and community care and how it was introduced. Now, a simple example that I would like to give here, if I look at, when you were accessing, you wanted to go to a GP before the National Health Service were there. I'm talking in reference to, say the 1940s. you had to pay a GP visit charge of 5 shillings, which is equal to 5 pence today, right? If we access national, if you go to your dentist, I think a couple of years back, the minimum charge that when you go and see a dentist is 19 pounds or is about 20 pounds. Today, that has jumped to 48 pounds. So these are, when you look at prescription charges, I think prescription charges are about 5 to 7 years back were 7 pounds and 20 pennies. Today, they are about 10 pounds and 40 pennies. So you pay the prescription charge, but at the end of the day, you get all the medication absolutely free from the pharmacy. Now, these are all expenses and charges which the National Health Service takes up. If you're pregnant, if you're over 60, you're retired, and you are a senior citizen, then, or you're a war veteran, and if you're under 16 as a child, then these are absolutely free. You don't need to pay prescription charges. But if you're not in any of these categories, then you will need to pay prescription charges. Now, all these charges add up to expenses which the NHS actually looks at, recouping from the taxpayers' money. Now, there is some calculation here which basically talked about that when Sir Roy Griffith introduced, the reforms and suggested that these need to be done in the National Health Service in order to make, provisions and adequate budgeting and funding to be done. There were some initial estimates which were done that, okay, if this was the charge, then government had to estimate and put aside 150 million, as prescription charges in the 1940s. But now, if you look at that, prescription charges are to the tune of about 700 million pounds a year, because that is the amount which the people pay. And then the balance part of it is actually, provided by the government through the, allocation of budget to the National Health Service. So this would give you a very good understanding of why health and social care community provision and how it came about within the UK, and how steadily over the years, over the decades, the reports which have been published, in particular the Griffiths Beverages Review, then followed by Sir Griffiths report, and then Lord Darzai's report, and the last one, Marmot Review, basically then provision for community care within the National Health Service. Is that okay? So this handout, I would suggest about 8 pages, 10 to 15 minute read is a must that you need to do so to be able to understand the background and history about the social and community care provision which has been introduced as a part and parcel of the National Health Service. Is that okay?
Yes,
now,
sir.
in the presentation, this part which you see, the slides which start from welfare estate to the 3 approaches of the background in terms of how this came about, and then discussing into health part of it, and the community care part of it is actually from the handout that I've created. So if you read the handout, then you would have covered these slides, because it will give you a very good idea in terms of what are the key timelines and what are the key developments which have happened essentially over the decades, which has led to the creation of community care, within the UK. Is that okay? Now, task 1 or assessment criteria 2.1 talks about defining key milestones in the advancement of how social and community welfare provision came about. Now, timelines are mentioned in the slide. There is this particular timeline that I mentioned on the slides, which is using a table. And this particular bit is also available on Moodle in one of the handouts under this particular unit. You can use this, but at some stage when you do the assignment and, for the purposes of addressing this criteria, what you have to talk about is basically tell us what are the key milestones under which this particular community welfare provision was introduced in the UK. So I've done another slide here, which is like 4 or 5 paragraphs, which talks about the major developments. And you could also look at reading this table in a great amount of detail. This table is available as a PDF document for you to read. And I've used screenshots of this to primarily provide the important times and changes which have been brought about over the decades from 1948 to 2006, which has led to the creation of community and welfare provision in the UK. Now, the second assessment criteria talks about comparing and contrasting the current healthcare provision and the services, and what were these services prior to the creation of community and welfare, services. So when we know that we have seen that, okay, community welfare has been introduced as a part of health and social care services in the UK, slowly and gradually after 2006. Now, if we are to compare and contrast, what I mean by that is, how was it before 2006? Is what you need to put in terms of a table here. So talk about and things and think about things like financing, access to care, what were the services being provided, quality of care, and look at technology and obviously private public partnership. And what you need to do is then develop this into a particular table saying that, okay, this is what is available today, and this was what was available 20 years back. When say, for example, in the Sir Griffiths report of 1986, these things were being put into place. So in the National Health Service, community and welfare services were also being introduced. Although we see the beginnings of this being put forward by the Beveridge Review in 1948, this actually was reviewed again in the 1980s, and that report published the findings saying that they are still being addressed, they are still on paper. There was nothing in practice available. So that report essentially led the government to actually start allocating budgets separately. And what you need to do is compare these two times on a table, which will tell you what is present and what was in the past. And that can be done by looking at heads like financing. Does the government allocate funds today for community provision? Do the councils get money to be able to provide health and social care services? So if you look at your council tax bill, I don't know how many of you have looked at your council tax bill. Most of you would have been receiving the bills now, which is for the year in the month of April. You would generally see a part of your council tax bill is broken down into a pie chart on the associated booklet that you get. And that booklet essentially shows you the breakup of how the council is using money to be able to provide for some of these services, like health and social care, schools. You look at fire and ambulance. You look at infrastructural services, things like that. So let me try and see if I can bring this out on something in terms of expenses. So this would give you a fair idea of what you need to compare essentially when you look at your council tax bill. So I've got one here which I want to bring out and show you. So for example, this is the council tax bill essentially for Tameside Council. You can actually do a search and find, if I show this to you now on the Google. So what I did was I said council tax expenses in Manchester City Council as a pie chart. If you do a quick search of this, you'll be able to find, council tax bills and how the bill is actually broken down into various services for your area, right? Now, if I go back and look at this particular one in terms of, how the charges, the council tax that I pay, depending on the type of property I live, and how these charges are actually used by the local council. If I just take you back to the presentation, because I've dragged the image here, you can see this is how the the tax that we pay to a particular council, just as an example, is broken down. So it says adult services 41 million, children's services 48 million, population health 16 million. You look at governance, you look at operations and neighborhood, place, corporate cost, and schools. So if you see, this is a major breakup of how your council tax that you pay is actually being used, broken down into the money that you pay is being broken down and then provided by your local authorities in terms of services. So obviously adult services, children's services, and population health would be the combination of what we get to see being used as a budget for health and social care. Now, some part of this, if we go down into further breakups, will actually show us what is the breakdown of this budget being used for social and welfare community provision. That means services which nurses, healthcare workers tend to provide when you receive them in care home, in your home, or in hospitals and GP surgeries, and those kind of services for which the money is being paid for by the members of public and by the government is actually shown in this particular chart. And that is what you would need to do in terms of comparing it on the table. So it talks about compare and contrast. That means what are current health services provision and what was previously being provided, is what you need to look at when we look at coverage of this particular assessment criteria. So overall, what we want to do is find out what changes have happened when we compare this in terms of the the changes that we see which have been implemented after 2006. So what you get in terms of services now and what was in terms of services before 2006 is what we need to bring across in this assessment criteria. And that would be, looking at covering learning outcome 2. So essentially 2 aspects is what we need to understand. One is a timeline of how community and social welfare provision came into our, into our society. And that is looking at a timeline from 1948 to 2006. And the second assessment criteria looking at covering, the what we get today and what we were getting before 2006 is what you need to cover in this second part of the criteria. Any questions on this that we've discussed so far?
No, sir.
All right. So with this, what we will do is we will close learning outcome 2 today. And then on the Moodle, which I want to show you, there is learning outcome 3 as well, which I put in. So my suggestion would be to go in and then read the learning outcome 3 as well, for which we'll be looking at doing a session next week, Saturday. And that should be looking at, completing this particular part of the unit. So let me just quickly mention what you have to go through and reorganize that slightly. So this unit that we are studying will be shown in a yellow border. It'll have a bit of a yellow border outside it. So we are looking at studying learning outcome 3 next week. And then we have done learning outcome 1. Now there are the bits that you need to be aware of. One of them is the unit specification for this unit. So learning outcome 1, 2, and 3. This is the unit specification. Then we have a handout on healthcare systems, the 4 basic models that have led to the development of healthcare systems across the world. So the beverage model has led to the creation of a healthcare system in most of the Western economies, Europe, England, you look at UK, Australia, Canada, New Zealand, South Africa, and, most of the countries in the European continent. The Bismarck model, which was followed, essentially has led to the creation of a healthcare system in the US and some other countries like Germany. Then we have the national health model, which is predominantly seen in the American style, healthcare system. And then out-of-pocket model, which is now currently seen in more developing countries in Africa, Indian subcontinent, China, wherein it's a combination of both the services being provided by the government as well as funded by the by the individual as well. So private and public, contributing towards providing health and social welfare within these countries. This is a good handout just for comparison purposes to understand the 4 different kinds of systems and models which have been, which are now prevalent in the world. Then I've mentioned this particular handout that I want you to read apart from the slides of the learning outcome 1. This 8-page handout will give you a full summary of the unit. There are 1 or 2 other important, I would say, handouts that I've also included, which are, for the understanding of origins and development of social care. This particular handout has the timeline, which is focused on today's discussion. So it gives you a full rundown of how social and welfare provision came into the UK and what are the origins of that in terms of history. This is a good handout which is about a half an hour read. And what I've done is when I mention, the timeline which is required, I've actually taken up the timelines from the last few pages of this, handout. So this is, I would suggest, is a must read for you, because this will explain why there was a need, what the government has done, the Griffiths report, the beverages report. So the Griffiths report, is published in detail in this particular handout. And I would suggest, if you want to read the beverages report, is also here. So it'll give you a good understanding of these two reports, which are important for this particular unit. And what we've done right now is we've covered the learning outcome 2 and the healthcare systems around the world, just as a bit of a perspective. And those are both documented here. We'll be covering learning outcome 3, and there are 2 handouts which are put in for them for assessment criteria 3.1 and 3.2. They discuss the core values which underpin our social and healthcare delivery system in the UK. And the second one looks at the ethics of it for regulators in particular. And they will also be a good reading for, related to learning outcome 3. That is what we'll cover next week. So this unit is fully populated, fully available, and you should be able to look at going through this in your own time to develop a bit more understanding of what we've discussed with regards to our discussion and session today. Any questions on this so far?
Excuse me, please. The handout you said, is it under the workbook?
No, the handout is here. The handout.
Okay. And that's welfare provision. Okay.
So handout is handout.
Yeah. Thank you.
Can I ask a question? Can we use the information from the handout to
Yes,
prepare our assignment? Yes.
Yes, you can use the information from the handout, but you'll have to make sure that you're paraphrasing it and you're writing it in your own context.
Okay, thank you.
We'll do the discussion on the assignment brief, for this session on Saturday, because the assignment brief is basically 2 tasks and it's about 2,500 words, but it will be looking at drawing up an essay, and that would be looking at bringing into the readings that you're doing across learning outcome 1, 2, and 3. And that is where the handout will become useful. And then the task 2 is about creating a poster, which is going to be looking at discussing the timeline of community provision in the UK, and also looking at understanding what are the differences between the current healthcare provision and the earlier healthcare provision, directly related to the second assessment criteria that we've discussed today. So compare and contrasting is very important. And both these handouts are going to be very useful. One, which is in the Word document here, and the second one, which is primarily looking at origins and development of health and social care, welfare provision in the UK. Both these are going to be important for your assignment, and you will get most of your work or the discussion that is required, output that is required to be done in the tasks for the assignment will come from here. Okay.
Okay.
Good stuff. So enjoy the rest of your evening. I'm going to close the session now. If you have any questions or think of any in the future, please drop me an email. And then we are going to be meeting next week to cover and complete this particular unit. I think my suggestion would be to have a session on Saturday, which will be the usual timing of 10 a.m. And then a session on Sunday, which is like that we are doing today. Sunday, we'll discuss the assignment, but Saturday, what we'll do is cover the learning outcome 3. So 10 and 4 p.m. Next week is what we will take up for this particular unit. And for those of you who need the copies of recordings of today's session, I would suggest that you go onto the YouTube channel and you'll be able to get a copy of the discussion that we've done today, including the recap of the learning outcome 1, along with that in that session.
Excuse me, Raman.
Yes, go ahead.
Are we going to have a session again on Sunday?
Yes, we are going to do next Saturday and Sunday both. Saturday will be usual times of 10 a.m. and Sunday we'll do the assignment discussion, which will be 4 p.m. like today.
4 p.m. and on a Friday, normal classes.
Normal class on Friday, yes.
Right.
Saturday you said 10. Is it on level?
10 to 11, and then Sunday 4 to 5.
Oh,
Okay,
okay.
good stuff. And this session is also live, so you can actually get this under the live, and that will be coverage here.